Welcome to another episode of the DMT lecture series. Today we are talking about onchocerciasis, also called river blindness. So, by definition, it is a chronic filarial disease present in areas around rivers. It is a neglected tropical disease caused by the parasitic worm Onchocerca virus. It is transmitted through repeated bites by blackflies of the genus Smilium. This onchocerca virus is transmitted through the bite from a female blackfly, which breeds usually in a rapidly flowing and well aerated water. So here is the life cycle of this onchocerca virus. Usually, it has two stages. It has two parts, I may say, the blackfly stages and the human stages. It begins with the blackfly coming to take a blood meal. As it takes a blood meal, the larvae stage, the side larvae stage, they are deposited through the bite, and these develop under the subcutaneous tissue, thus developing into adults, which are the female and the male. These adults produce unstitched microfilari that typically are found in the skin and in the lymphatics of connective tissue, but also occasionally in peripheral blood, urine, and sputum. This is a diagnostic stage. This stage 4, it is a diagnostic stage. So it continues. As it is developing now a blackfly again, another one may come and take a blood meal. It now gets infected. So it is infected by the microfilari, which penetrate now into the blackfly's midgut and migrates to the thoracic muscles. And these microfilari now develop into larvae 1, larvae 2, until the larvae 3 stage. These now migrate to the head and blackflies proboscis, where they now are ready to be injected into any human being on a blackfly coming to take a blood meal. It will present with these clinical features, which may either present in the skin or in the eye, depending. When it is in the skin, there will be onchosarcoma, where there is painless, smooth subcutaneous nodules containing adult worms, adherent to the underlying tissue, usually on the body prominences like iliac crest, pelvic girdle, ribs, and skulls. Also, there is acute papillary ochodermatitis, where there is intense periodic rash or edema. This is due to the microfilari. Also, there is late chronic skin lesions, where there is a dry, thickened, peeling skin, and it appears as a lizard skin. There is also atrophy, purged pigmentation. When it affects the eye, there will be inflammation of the eye in the areas of the cornea, ovea, and the retina. This will lead to visual disturbances and thus blindness, as it is river blindness. And also now we're going to the treatment. For the treatment, we may treat as either a case or mass treatment. For the single case, we are now going to use doxycycline 100 milligrams twice a day for 6 weeks, followed by ivermectin 150 micrograms per kg single days. And in the mass treatment, we're going to use ivermectin, which is 150 micrograms per kg once yearly for 10 to 14 years. This is usually not recommended for children less than 5 years or in pregnant or breastfeeding mothers. No food or alcohol should be taken within 2 hours of a dose. Now we're going to the prevention. In prevention, we are either controlling the vector, where you are going to do you make measures that will prevent the vector from infecting anybody. Then there is also mass chemoprophylaxis. There is also establishment of villages away from the Smilium breeding places. Also, you may use repellents, and also people may also wear the protective clothing. Thanks. That's the end of today's lecture. Thank you.